Have you ever seen a person fall down and start jerking or convulsing, and you wonder what could be wrong? Could it be an infection or a disease? What is it really? Well, in this video, we're going to be looking into seizures and epilepsy, some of its signs and symptoms, and what to do to help a person experiencing seizures before the person is taken to the hospital. So come along with me, let's shed more light on this topic. Hello everyone, you're welcome to my YouTube channel. It's your next door nurse. If you're just joining us, you're welcome to the family. Kindly subscribe, like and share. Thank you. A seizure is a sudden change in the brain's normal electrical activity, which can cause changes in movement, feelings, behavior, and consciousness. If a person has one or more seizures or recurrent seizures, that person may likely have epilepsy. The cause of seizures are usually unknown, but it might occur after a stroke. The person has extremely low blood sugar, a closed head injury, alcohol abuse or alcohol withdrawal, drug abuse. In children, it can be as a result of high fever or severe dehydration. In women, it can be as a result of eclampsia. Eclampsia is characterized by high blood pressure, protein in urine, and edema, that's swelling, especially in the feet. Then in some very ill persons with infections such as meningitis, that's inflammation of the brain and spinal cord membrane, you have the cerebral malaria, that's malaria of the brain, or poisoning, that's inhaling or ingesting harmful substances. There are different types or kinds of seizures. One is the tonic-clonic seizure, also called or known as generalized seizures, and is the most common type. It is characterized by convulsion, unconsciousness, and muscle rigidity. 2 is the myoclonic seizure, which is characterized by sporadic or isolated jerking movements. 3 is the atonic seizures, which is characterized by loss of muscle tone. 4 tonic seizures, which is characterized by muscle stiffness and rigidity. 5 clonic seizures, which is characterized by repetitive jerking movements. The signs and symptoms of seizures can range from mild to severe. There's temporary confusion, a staring spell, the person just stares at you. There's loss of consciousness or awareness. There's uncontrollable jerking movements of the arms and legs, and also you can have cognitive or emotional symptoms like anxiety or fear. There are some things to do, but there are some things you can do to assist or help out a person that is experiencing seizures. You try to figure out the cause of the seizure. If it's a child and the child is having high fever, you lower the fever by exposing the child, remove all clothing. Then you give the child a cool bath, not cold bath. Then you can also sponge the child using cool water. Then if the child is dehydrated, you give dehydration drink, or you give the child water to drink. If you suspect the person has meningitis, and some of the signs of meningitis are fever, severe headache, neck stiffness, involuntary movement of the knee and hip, or vomiting, or you suspect the person has cerebral malaria, that's malaria of the brain. And some of the signs of cerebral malaria are fever, chills, fatigue, body aches, and sweating. Or you suspect the person has eclampsia, you seek medical help immediately. Do not waste time. And also, during the course of the seizure, do not give the person anything by mouth. Don't put anything in the person's mouth, because if you put anything in the mouth, the person can bite on the tongue and they can be bleeding. Now let's talk about epilepsy. Epilepsy is not an infection, so it cannot be caught. It is a chronic, non-communicable disease of the brain that causes unprovoked recurrent seizures. Normally, the brain continuously generates tiny electrical impulses in an orderly manner, but in epilepsy, the brain's electrical rhythms have a tendency to become imbalanced, resulting in recurrent seizures. So you can say a person has epilepsy if he has had at least 2 recurrent seizures that are not caused by the medical conditions that were mentioned earlier. For the types of epilepsy, we have the primary generalized type, which begins from both sides of the brain at the same time. Then we also have the partial epilepsy, which arises from a limited area of the brain. Some of the risk factors of epilepsy include trauma during birth as a result of lack of oxygen, seizures in the first month of life as a result of high fever, seizures occurring within days of head injury or within days after head injury, brain tumors, and family history of epilepsy. The tips I'm going to be sharing now cut across all types of seizure and epilepsy. During a seizure or an epileptic seizure attack, try to keep the person from hurting himself. Remove any hard or sharp objects around where the person is having the seizure. Do not give any pain by mouth. Do not restrain the person or try to force the person or hold the person down. After the seizure, the person might feel sleepy or might feel dull. Allow the person to sleep. When the person wakes up, take the person to the hospital immediately so that further tests can be done for the person. So guys, give me a thumbs up by clicking on the like button if you find this content helpful and useful. Kindly subscribe, click on the notification bell so you'll be the first to know when I upload new videos. Drop your comments in the comment section below and I will attend to them. Don't forget, I'm your next door nurse and I'm just a knock away. I love you guys. See you in my next video.